Hi, this is Amy McCoy, and this is my curriculum development project for Nursing 575. The program that I selected is a 4-year baccalaureate program. It consists of 8 semesters. The delivery is hybrid or blended delivery, which is online and in-person delivery. The model is integrated, which consists of required courses being non-nursing and nursing elective courses in humanities, social, natural, and health sciences, and nursing courses over the last 2 years of the program. Students will apply to be accepted into the nursing program starting the last 2 years of the program. They have to be accepted into the program. The nursing core courses will include labs, simulations, and facility clinicals. At this time, I have no listed specific partnerships, but does allow for transfer students from other programs. The method and program delivery, or hybrid or blended delivery, in-class face-to-face lecture that consists of labs, simulations, online simulations, and then online quizzes, so it hybrids the in-person and the online in it. And then it will also have in-facility clinicals, and then the final semester being a senior leadership course with integrated nursing practice that can be either as a capstone within the program where they follow a specific nurse, or they just do specific kind of clinicals. The organizational strategy is simple to complex. Students will build on their knowledge, so they learn more information over time. They begin with some knowledge that they build on top of that knowledge. Learning more about the concept over time. Concept-based framework are introduced early in the curriculum and are repeated in the course to build on knowledge. Course sequencing patterns and involve block pattern, which has students learning theory with professional practice and professional practice on its own without theory learning. Pattern that was concluded in being helpful in learning experiences according to Islov. Educational philosophies and theories. I picked 3 theories here. The first one being progressivism theory, is that the world is in a constant change and students must learn to function successfully and adapt to the changing world. According to this philosophy, students should actively engage in experiences that build on their mental, emotional, physical, spiritual, social, and cultural studies. Some students that engage in experiences which involve problem solving and shared decision making, allowing students to experience nursing and human experience to develop progressivism. Cognitive, so the second theory is cognitive apprenticeship that involves teaching and learning where students participate with experts in practice to learn expert knowledge with physical skills such as hands-on learning, procedures that are demonstrated and then performed, such as on-campus labs. Students will, with modeling and coaching with this cognitive apprenticeship, the modeling and coaching will help their confidence and their independence in their practice and with clinicals. Professional practice where students are able to learn nursing knowledge and clinical reasoning with a supervised coach, so that they're able to confidently practice nursing outside of school. And then the third one is experiential learning. Allow students to learn from experiences, physical experiences and clinical practice, lab and simulation in which students can learn from. So this kind of ties into a cognitive apprenticeship, kind of a different kind of theory, but reflective observation in which students observe learning behaviors and are able to reflect back on learning experience. So they learn from experiences that they have. Students are then able to plan for active experimentation for clinicals and on real life patients. So they can practice ahead of time, and then when they go to clinicals, they can further expand on this theory. Students are able to plan for active experimentation for clinical experience on real life patients. Students are able to learn about principles and guidelines for the future practice at clinicals and beyond in their nursing career. So what they learn now, they're going to pass on. According to the AACN, building nurses who are resilient, able to reflect on the future of their care, this ties into the experiential learning. So here's the breakdown of the flow of the classes. The first semester, they're going to start with English 101, human anatomy and physiology, human development, and public speaking. I chose this pattern because the AACN and the IOM believe that a liberal arts background of students helps make a more rounded nursing student, and they're able to fully understand different cultures and different parts of the nursing practice. So I chose just basic English writing so that they can start with that and they can be successful in their nursing courses, because there's a lot of writing and other things in the nursing courses. Also, human anatomy and physiology, so they get the basic outline of the human development, also so they get human from birth to older age, and then public speaking, so that students are familiar with public speaking within their classes and anything they have to present, and then more comfortable in turn talking to patients. Semester 2 are start with health sciences, allow future nurses to educated to work with other science disciplines, to allow them to work collectively with other disciplines for patient-centered care, according to Islov. I've chosen statistics to allow a solid base for nursing education that helps basis of math and knowledge and how to judge healthcare problems, according to the AACN, or the American College of Nursing. The IOM believes that more nurses should have a BSN background because the BSN students get this kind of background. That's why I chose the order of the class. They want 80% of the future nurses to be BSN educated, and they want to help. They believe that this will help increase patient safety, so that's why I chose to start these courses off this way. In the second year, they're going to continue with their health sciences and social sciences, so they can build on their education. These courses are important to the BSN student to help future well-rounded students because it helps provide the foundation for development of critical thinking skills and clinical judgment. Integrated courses of behavioral, biological, and natural sciences help provide the knowledge for understanding complex clinical problems, according to the text Freiberg. In semester 3, students are given the foundation courses for behavior, biological, and natural sciences, because they start with microbiology, pathophysiology, a history course, humanities, and a social science. Semester 4, then we'll start the nursing courses, so they have to apply to the program to get in to start semester 4. Students are accepted in the program, so they'll give foundation courses for professional nursing. Then they're given fundamentals of nursing care, health promotion, and pharmacology. So it starts with their basic nursing courses. Complexities of healthcare require that nurses have the framework to prepare them to practice nursing safely, according to the text Keating. So that's why I'm going with this order of the classes. And then semester 5, they start more into the nursing core courses. So they'll start with healthy aging, evidence-based practice for nursing, and then caring for the childbearing adult family with lab and simulations. The Colorado Board of Nursing states that students should have an education that is sequenced to facilitate learning. Students given courses to build upon nursing knowledge, so they're starting from the bottom and they're building up on their courses. Then we go to semester 6, which involves beginning to learn about medical conditions and nursing care of adults, nursing care of children with lab and simulation, and then, of course, informatics in healthcare setting, which every healthcare setting now uses computers, so I believe this is an important course for the students to learn about. Semester 7, they're going to do nursing care of adults 2, so they got course 1, now they're building on course 2, which will build on their knowledge and get more complex healthcare conditions. Then they're going to focus on public health, which is a big deal with many of the communities, for them to have a background in public health, or at least learn about some of the public health, even if they're not going to go into public health. And then semester 8 will focus on, so they'll start with their nursing leadership. According to the American Associations of Colleges of Nursing, leadership skills are needed to emphasize ethical and critical decision-making, initiating and maintaining effective working relationships, using mutual respectful communications and collaboration with interprofessional teams, care coordination, delegation, and developing conflict resolution strategies. So the nursing leadership will just give them a good foundation for building their nursing practice and having those leadership skills. They are then given a integration of nursing practice with lab simulations and clinicals. So they either follow a specific nurse in their chosen profession, or they build on their knowledge with different kind of clinicals or different kind of field that they want to go into. This capstone and integration will also help them to study and pass their NCLEX, which is an ultimate goal in the nursing program. The student learning outcomes: by the end of the programs, graduates should be able to apply the latest evidence-based practice in nursing profession, apply leadership skills to nursing practice, use effective communication skills, building on that leadership, able to provide nursing care in the healthcare setting with the collaboration of other healthcare professionals. So also building on more of that leadership skills so that they're able to successfully practice. And then, of course, their final goal of passing NCLEX so that they can be future nurses. These next two slides are just my references, and thanks to everybody for watching. I'll just go through these references.